Okay, so 2 weeks ago, we starting to have an introduction for cold and flu product. So we are up to this case 2. So today we started this case 2. So this customer, Mr. Wong, 60 years old, just came in to the pharmacy and want to buy some cough syrup. And his symptom, headache, runny nose, coughing. Okay, so we asked the question 2 weeks ago. So mainly, normally you have to find out if not the person, you have to ask who is the patient, and also checking are they on any other medication or any other medical condition, and if the person is a lady, you might have to consider whether is there any chance they might fall pregnant? Yeah. Okay, next one. Okay, so like this, taking any other medication, pregnancy or breastfeeding. And because some of the cold and flu tablet, they can trigger the either asthma, glaucoma, or prostate issue. Sometimes can be aggravate or constipation. Okay, so those things we have to take into account. And a very common thing is when people have diabetes during they have a cold or flu, their blood sugar will tend to increase and bumping very high. Okay, so normally I think in Taiwan they consider the blood sugar normal level is around 120. Okay, in Australia we use different unit, so it's about 5.5. Okay, but when patient have flu or cold, I think the temperature, the blood sugar tend to like double, or sometimes can be triple. So it's very important when patient have diabetes and when they're having a cold, you need to ask them to monitor their blood sugar level. 所以这个地方讲的就是，如果病人有糖尿病当他们感冒的时候，他们的血糖可能会飙高，可能是有时候2倍，甚至会到3倍。所以呢，他们在感冒的时候一定要一直不断的去监测他们的血糖，可能一天要测到2次到3次所以要提醒他们，如果有血糖机的话他们要不断的去侦测。Okay, so what's the like dangers or some warning symptom we have to be careful when we have a patient in the pharmacy? First one is high temperature for 3 days. See, if they have temperature for 3 days, very high temperature for 3 days, which means maybe it's not appropriate to get some medication in the pharmacy. You might have to refer them to the doctor. Is it a child or is it elderly, older people? Yeah, because those those people tend to have very severe issue. Yeah, when they have the cold, you have to be careful. Or if they have any chest pain, sore throat, or the coughing, they won't go away. Yeah, sometimes the people come in just say, oh, they've been coughing for couple of days or even months. Okay, so we have to find out what is the reason, what is the cause behind. It could be a medication, some ACE inhibitor for cause dry cough. And if the coughing more than a couple of months, okay, sometimes it could be cancer or something in the lung, keep irritating the issue. So they need to see the doctor instead of just come to the pharmacy and get some cough suppressant. Okay. Or when they the sputum, sometimes it's a color like in yellow or even in green or even smelly or have blood in it. That's the warning signs. The patient maybe need to see the doctor, or checking are they driving, or are they normally their job is to operate the machinery, because some medication can make people feel drowsy, like the first generation antihistamine or some painkiller in Taiwan, something with codeine. They can make people feel drowsy. So there has to be, we have to tell the patient, yeah, you can give them a medication, but you just have to advise them. This one can make you feel drowsy, yeah. Okay, so this patient, Mr. Wong, 60 years old, and he's on perindopril, which is for the blood pressure, metformin, okay, it's for the blood sugar, and sitagliptin, blood sugar, sertraline, which means sometimes it's for the depression, and atorvastatin for the cholesterol. And aspirin, normally lower dose, is for people having diabetes, blood pressure issue. They can help to thin the blood. Okay, it's very common. Aspirin, lower dose, used for elderly people. Okay, so from the medication, you have an idea the patient have high blood pressure, cholesterol issue, diabetes, and depression. Okay, so what should we be careful when we trying to recommend any over-the-counter medication or product? Okay, some medication can cause cold or flu-like symptom. Yeah, so when they have sometimes when they have the blocked nose, you might have to think, is it caused by medication? Some beta blocker like metoprolol, propranolol, can make your nose block, and also alpha-1 blocker, or some symptomatic nasal spray when they use more than 5 days. When they use, normally the nasal spray for the symptomatic, they tend to help for the congestion for your nose. But if they use for more than 5 days, they will cause the rebounds, blocked nose. 所以有一些这个鼻黏膜喷剂呢，它本来是用来帮助你解除鼻黏膜有充血的情况，可是如果使用超过5天的时候，它反而没有效果，因为它的效果它反而会超过5天，它没有效，而且会导致它会有反弹性的这个鼻黏膜充血。So we always advise patients, if they are using some nasal spray for the nasal congestion, no more than 5 days. Yeah, if they want to keep using it, after 5 days, have a break for a couple of days before we use the nasal spray. And also those nasal spray is a symptomatic. So for people having blood pressure issue, they can increase the blood pressure, and also causing some, making your heart rate go higher, and also can, when people have diabetes, those sympathetic nasal spray or sometimes pseudoephedrine, they can increase the your blood sugar as well. Okay, and how about some other medication that cause like sore throat symptoms? Yeah, some people come in say they have sore throat, and you might thinking, oh yes, could be just a cold or flu. But when you ask what medication are they taking, they probably is a immuno compromised patient, like some people taking cytotoxic, or they on chemotherapy, or sometimes they're using like too much steroid. Okay, for those medication, they tend to suppress their immunity. So sometimes when the immunity is a bit low, they will catch cold or having cold or flu easily. For those people on those medication and coming to the pharmacy, make sure you refer them to the doctor. Don't no point to keep them in the pharmacy or taking some over-the-counter medication. Just refer them. Just say you need to see the doctor. Maybe something to do with your with the medication they are taking. Okay, and some medication causing cough. Yeah, just like I mentioned, ACE inhibitor or angiotensin 2 receptor blocker, or even beta blocker. And beta blocker can also slow down your heart rate. So when patient have heart failure, sometimes it can be very severe, because heart failure, the heart is not pumping well, and beta blocker can also making the heart pump less. And when they pump less, it will make your lung causing the maybe edema. So that's why they have cough more. Yeah. Okay. Or sometimes when they have severe liver or thyroid issue, why we ask them if they have thyroid issue? Because for those like pseudoephedrine or ephedrine, those sympathetic 这些交感神经的这些刺激剂呢，those medication 这些刺激剂will make the thyroid, will increase their thyroid issue. So if they already if the patient is hyperthyroidism, those medication can make it worse. Okay. So hyperthyroidism, sympathetic agent should be avoid. We try to avoid, yeah. And also for diabetes, yeah. Sometimes they probably need to increase the insulin dose, so according to their blood sugar level. So you need to advise the patient, the diabetes patient, if they're having a cold, make sure they check their blood sugar twice a day or even 3 times a day. Yeah. And also they have to maybe increase the insulin or diabetes dose. Okay, and people having asthma, because sometimes we have to give them the NSAID, 那些消炎药NSAID 就是消炎药. So those NSAID, they tend to aggravate the asthma. It doesn't mean you can't if the patient on they have very severe fever temperature, like go up to 39. Sometimes you still can recommend some like ibuprofen, Voltaren. That's okay, but you just have to tell the patient, okay, it might aggravate your asthma, so you have to advise the patient. Okay, and some antihistamine, especially the first generation antihistamine, they have anticholinergic effect and also can causing sedating effect. So anticholinergic effect is no good for people having glaucoma. Glaucoma 就是青光眼。所以青光眼就是我们的眼压呢，它是过高的。那这些 anticholinergic effect 它会让你的这个眼压升高。Or people having prostate issue, the anticholinergic can make the patient, especially the male patient, they have more problem to pass the urine. 如果他们已经有前列腺的问题，如果他们的这个 antihistamine， 因为 antihistamine，他们通常有附带这种所谓的抗胆碱的 anticholinergic 的这些 side effect， 所以会让他们那个尿呢会更不容易排出来。And also anticholinergic can cause constipation, okay, or even the colding. Sometimes colding might cause the constipation. Okay. So high temperature more than 3 days. Yeah, we already talked about that. Yeah, that's the sign to refer. And if that and any kidney issue or endocarditis, rheumatic fever, or artificial heart valve， 就是说他们如果有心脏或者是肾脏的这个问题，或者是他们曾经有过这个风湿热，或者是说他们有人工瓣膜，因为这些都是比较，如果他们有这些情况的话 ，if they have those medical condition， when they having a cold, sometimes can be very something might happen. Yeah. So you have to be careful when they have those issues. You have to ask them or treat them carefully, even maybe refer them to the doctor. Okay, and baby and elderly patient, we know for aspirin is not recommended for under 12 years old because it can cause Rey syndrome. Okay. So we already mentioned that 2 weeks ago. Yeah, the common ingredient in the medication, the cough syrup they sold in Taiwan. Okay, aspirin, not aspirin, acetaminophen. Okay, Panadol and methylephrine, which is a nasal decongestant, and chlorpheniramine, which is the first generation antihistamine, can cause drowsiness, and caffeine. Caffeine is 就是咖啡因啊，你看咖啡因在这里的效果是什么啊？因为咖啡因是一种兴奋剂，有时候它对于解除so the medication cough syrup have caffeine is because they can sometimes help for the headache and also increase your have some excite your body. So sometimes people when they have cold or flu, they tend to be they probably will be feel very low. So sometimes when they have caffeine, will help them to higher them up. Okay, and also you can see some cold and flu syrup in Taiwan. They have ginseng and also some Chinese medicine. Yeah. Okay. So nasal decongestant, the mainly is belong to the sympathetic， 就是类交感神经刺激剂啊。So 它们的这些主要的成分的the ingredient in those OTC is like methylephrine, pseudoephedrine or phenylephrine。那我们知道那个 pseudoephedrine 就是这个所谓的伪麻黄素。这个就是用来制造这个安非他命的。So pseudoephedrine is some druggie. They used this ingredient to make the amphetamine. Okay. Okay, symptomatic effect. What is that? Because when we say symptomatic effect, mean they can increase the heart rate and increase the cardiac constriction. 你的心脏会收缩, and also increase your blood pressure, increase the eye pressure, increase your blood sugar, and also causing your bladder to have issue to pass the urine. And also for hyperthyroidism, okay, symptomatic will aggravate the issue. Okay, antihistamine, the first generation 第一代的这个抗组织胺呢，主要就是常用的就是这三种 chlorpheniramine, pheniramine, or dechlorpheniramine. So normally the antihistamine first generation normally used for allergy, skin rash, and sometimes for motion sickness, 就是晕船。有时候这个我们也会用到类似的这些药。But side effect dry drowsiness and also dry eye, dry mouth, causing urine retention. Okay, so those side effect is from the anticholinergic side effect. And also when people having prostate issue or they have slow bowel motion, 他们的肠胃蠕动比较缓慢的时候，或者是有便秘的情况，或者是 dry eye, 或者是 they wear contact lenses, we have to tell them this one can cause a lot of dry eye, dry mouth, will make the condition even worse. Okay. Okay, anticholinergic, already mentioned that so many times. Yeah, dry eye, dry mouth, water retention, and relax your bowel muscle, so which mean can cause constipation, and also can blur the vision, 让你的视觉产生一些好像模糊、不清楚的这种情况，这些都是属于 anticholinergic，就是所谓抗胆碱药的这些作用。Okay, one of the analgesic 在这个感冒药里面常见的就是像 aspirin， 但 aspirin 很少用了。然后这里的这个所谓的this is pregnancy category， 所以这里有3个 D， mean there's a 3D here, which mean the first D is first trimester, second trimester, and third trimester. 就是在怀孕，我们通常在怀孕里面会把它分为3期，第1期 trimester 1， 第2期、第3期。那有一些药是说第1期、第2期不能用，第3期可以。所以说你要去看，不是每一个药，不是那个药呢，在怀孕的任何的这个期都不能用，就是有一些可以，有一些不行。Okay, for acetaminophen, which is Panadol, in Australia is category A. So MU is say may be used. 这就是在澳洲的分级是叫做 MU。MU 就是说可以使用，可能可以使用。所以第1期 the first trimester may be used, second trimester may be used, and third may be used. But in FDA, it's a bit weird. In the past, FDA, the category for pregnancy for Panadol is A, but now they put it under B. It doesn't matter. Still, for any people that have pregnancy, Panadol is always the only one safe to be used. But the ibuprofen 是很常见的这些成药，药局的成药就是消炎药。那 FDA 呢，它是 category BB, but the third trimester is category D, which means D mean contraindicated， 就是这个 D 的意思就代表它是完全不可以使用，禁忌症，就是说怀孕的第3期的话，这个消炎药是不能用的。But in Australia is category C, mean caution, not recommended. So from here you can see the category are different between United States and Australia. but the idea are similar, but they have different way of to tell the health professionals. Yeah, that's it. But the basic idea are similar. Okay, and mucolytic 就是化痰药啊，化痰药 like very common use like bromhexine is category A, maybe used, yeah, they're all fine. And acetylcysteine 这个药的话是在台湾很常见，如果你感冒在药医院，医生都会开这个药。这个药呢很常用，但是在澳洲是没有这个药。But the category is B2. It's B2. You know, in Australia, we anything under category under B, we can't recommend for the pregnancy. Only if doctor recommended. Okay. 这个 acetylcysteine is an antidote for Panadol intoxication. 这个化痰药呢，其实在临床上还有另外一个用途，就是它是普拿疼的解毒剂，就是有些病人他们可能想要吃普拿疼来自杀啦，或者是普拿疼吃太多啦，中毒啦。那这个化痰药 acetylcysteine is an antidote for Panadol intoxication. 通常是注射。如果你送到急诊的话，通常它是用注射的针剂来进行解毒。Okay, antihistamine. Yeah, we know there's a first generation antihistamine can cause drowsy, but it's category A. 虽然它会引起嗜睡的副作用，可是呢，它是唯一可以用在怀孕妇女身上的一个抗组织胺。那比较新一代的 the second generation antihistamine like Carotine, Telfast, Zyrtec, they are category B. The reason for that is maybe because the research, 因为它是比较新的药的 this is the second generation. They haven't got enough study to support the safety for pregnancy. So only category 1 or category A, which is the drowsy one, the first generation antihistamine, can be recommended for pregnancy women. 所以虽然说会引起嗜睡，但是这是唯一可以使用在孕妇上最安全的抗组织胺。Okay, so antitoxin 就是这个止咳器，这个 cough suppressant。OK， 在 category A 有像 dextromethorphan， 然后或者是 codeine 就是我们一般台湾就会常说的叫做什么可待因这些都属于 category A, safe to use. But pseudoephedrine is B2, category B2, and FDA is C. So the nasal decongestion not recommended for pregnancy women. Okay. And antihistamine, we already talked about that from the last slide. Okay, only generation 1 antihistamine can be recommended. And the next one we have to talk about this syndrome called serotonin syndrome. Why we have to talk about that? Okay, so here you can see dextromethorphan, right? A lot of over-the-counter medication or syrup, they have this ingredient, and also codeine as well. So when those ingredients, they sometimes people are taking other medication for long term, and when they are on higher dose, they can cause serotonin syndrome. Why we mention this serotonin syndrome because serotonin syndrome can be deathly, vital. 他为什么要提这个症状？因为这个症状是会要命的，它是可以很严重的。那尤其有一些成药，我们其中有几项成分，我们要很留意。如果他们病人还有吃其他的药，我们就可能要去警告他。Now, what's the symptom? So mainly is increase the heart rate. Just look at the yellow highlight one. Agitation, restlessness, or high blood pressure, high temperature, or the last one, heavy sweating. So after taking the over-the-counter medication, if they have any symptom like that, you have to tell them to stop using it. Yeah, like sweating a lot, or stomach cramping, diarrhea, nausea, vomiting, high blood pressure. Okay, that is serotonin syndrome. 因为这些 serotonin syndrome 是可以要命的。Okay, and what are those common medication or bump into the over-the-counter ingredient? The first one is serotonin reuptake inhibitor, or 这些 SSRIs， 这个东西就是我们很常见的这些抗忧郁症的药 ，antidepressant medication, or those SNRI, yeah, similar. Those medication are used for depression, or some migraine tablet, okay, or people that have pain, they're taking tramadol, fentanyl, oxycodone, and see here, dextromethorphan. Yeah, dextromethorphan. This is very common, and actually it's a safe cough suppressant for pregnancy. But it would bump into, if the patient on those medication, they will increase the chance to have serotonin syndrome. Or sometimes the antiemetic 就是止吐药，例如说 metoclopramide, ondansetron, 或者是最后一个 Panax ginseng， 就是人参。所以这些药通常在一起就会增加他们病人有这种 serotonin syndrome。它不一定会发生，但是如果它一旦发生，有可能都会是很危险的。Okay. So what's the recommendation? Well, what are we going to, in this case, the case 2, what are we going to suggest? Okay, so this symptom, this case, Mr. Wong had runny nose, but we know he's got high blood pressure, diabetes, depression. So in nasal spray, we try not to recommend the sympathetic nasal spray, but you can still do it, that's fine. But if you really have to recommend that one, always advise there's a 5 days rule, okay? But normal saline 就是生理食盐水的这种鼻黏膜的冲洗剂呢，可能will be better than this one. And for antihistamine, yeah, antihistamine can help for the blocked nose. 对于老王来说，可能抗组织胺或者是这种生理食盐水的这种鼻黏膜的喷剂，对于解除他的鼻塞会比较好一点。And sore throat, sometimes 你可能可以推荐一些喉糖，或者是有一些这些betadine gargle, betadine 就是我们所谓的优点的漱口药水，它可以有杀菌的效果。And for the temperature, we can always recommend Panadol, acetaminophen. Okay, but what do we have to avoid? Which is first one, the syrup. 这些糖浆呢，通常是含有很高的，它们都是很高的这个糖 ，a lot of sugar content. And Mr. Wong's got diabetes, and when they have the cold or flu, their blood sugar will go very high. So we try not to recommend any ingredient in those syrup 啊，尽量不要使用糖浆。对，在这个有这个糖尿病的病人身上，好，所以因为我们知道有一些台湾有很多这些感冒糖浆糖，你要知道这个糖在这里的糖，对我们来说可能就是一点点糖，但是对于感冒中的糖尿病病人，这一点点糖就可以让他的血糖呢飙高，可能到3倍去了啊。And also ask them to monitor the blood sugar or blood pressure. And also, sometimes it might be necessary to discuss the serotonin syndrome. So, 就是说 serotonin syndrome, if they have high temperature, the stomach cramping, sweating, increase the heartbeat, yeah, those symptoms, then you have to ask them to see the doctor straight away and stop taking those cold medication, cold and flu medication. Okay, this one, we finish this one, this topic. 有没有什么问题 ？Any question？ 有没有？没有。Okay, so we will start the next one.